Hello and welcome to this series of videos. My name is Mohamed Hassan Taha. I am medical educationalist aiming at advancing medical education to support population health. This series of videos related to curriculum development in health profession education. Today's video will be about curriculum mapping in health profession education. So why it's very important to study curriculum mapping and what is a curriculum mapping? Curriculum mapping is the method to visualize and represent all components of the curriculum, including the competency, the outcome, the assessment, and the relationship with each other. And it helps us to develop a broad pictures of the taught curriculum and curriculum in reality. And as you know, curriculum is a complex blend of strategies, content, outcomes, experience, assessment, environment. So curriculum mapping makes this complexity transparent for not only the educator, for the students, for the other stakeholders, including the administrators. And the purpose is to improve the communication about what is taught, where, when, how, and answer questions like what are the students expected to learn and where it should be taught and should be assessed. And the curriculum mapping actually, it is spatialing what is taught, how, when it's taught, and how learning is measured, ensuring alignment between the teaching and the assessment process. And there are several benefits of this exercise, curriculum mapping. Starting with the transparency for the stakeholder, it helps to establish transparency for the stakeholder. Students know what, when, where, and how to learn, and faculty see where their teaching fit in the big picture of the curriculum. And the map makes the curriculum explicit rather than hidden curriculum. It helps us to align teaching with assessment and clarify that what is assessed match what is intended and taught, and reduce any gaps between declared and taught and learned curriculum. It helps to identify gap and redundancy in the curriculum. Mapping reveals if any outcomes or content area are either overcovered or undercovered. And this is very important to lead to help educators to do more efficient planning. Also, an integrated curriculum, an outcome-based curriculum, mapping hold curriculum together and unifying the frameworks. So bring all parts together. Also, it is a measurement tool, facilitate the curriculum review and update. Curriculum planners can easily see the structure and consider the implications for change, and administrative can track resource and responsibilities accordingly. In order to look at the curriculum mapping, we need to have a window through which we can look at the curriculum. And Professor Harden suggests 10 window framework for curriculum mapping. Let's see this window, starting with the learning outcomes as expected competencies, content and area of expertise, subject matters or tasks to be mastered. Methods used in assessment, you need to be mapped. Also, learning opportunities and learning experience, class, hospitals, simulations, venues where the learning take place, the resources, material, textbook, library, timetables, scheduling, staff, faculty, supporting staff, admin staff, curriculum management, the organization and administration of the curriculum, and the students also, including their progress, their portfolio, and so on. So this window provides a different lens to examine the curriculum, and a stakeholder can explore the map via any window from these 10 windows, because it like different lenses like different it is different 10 lenses through which we can look at the curriculum. And this is important of the curriculum mapping and for establishing the transparency of the curriculum. So it's very important to highlight that curriculum mapping helps us to link outcomes, content, assessment, and learning. So it is a powerful aspect of mapping is the linkage between these elements. It helps us to link outcome to content And each content topic or clinical conditions, example hypertension, is mapped to the outcomes and vice versa. It helps to link outcome to assessment. The map show exactly which outcome are assessed by exams or by station. Link outcome to resource to opportunity. For any given topic, the map can list all available learning resources, sessions, and addressing them. It helps to see the sequential integrations, and the mapping process often reveal how the knowledge built over the time. So linking basic to clinical science and behavior science and so on. Another important benefit is stakeholder perspective in the curriculum and planners and faculty. So for curriculum planner, the map is an essential planning tool because planner can see the entire curriculum structure at glance, which help in managing any change in the curriculum. For faculty and teachers, our colleague, for instructors, curriculum mapping is very important because provide context for their teaching, and it helps medical teacher to ensure their session matches the level of the students and the outcomes. Even for the students, curriculum mapping is very important because it empowers student-centered learning because it clearly outlines what must be learned and where this will take place. And the student can identify the gaps in their own learning and seek relevant sessions via the map. And also help them to support their personal development plans and the e-portfolio. And it like, because the curriculum is like a contract, so it will be like a transparent measure. So this is very important. Empower students' learning, enhance them, identify their gaps, support them to develop their professional plan. Also for the administrators, it's very important. Administrators, managers, because they can see the resources very, very clear and they can monitor. And even for the accrediting bodies, mapping is very important because they can see the different elements of the curriculum. We can do curriculum mapping in different way, like maybe content expert area or matrix representations. There is no black and white area here. You can use the different approach based on what you prefer. And the content area of expertise is often mapped in hierarchical manner, large content. For example, maybe start with competencies and then or EBAs, then domain of competencies, then milestones. Or you may stay with program learning outcomes, then courses learning outcomes, and then content and so on. Or in the themes or problems, if you are, or clinical presentation, if you are using clinical presentation and so on. So how to implement the curriculum mapping? Now we will move to the practical step. First step, you have to assess the needs and user, scope of skill, scope of task, decide on structure and data, choose the format, technology, populate the map, decide access and permissions, train, engage faculty and students, evaluate and update, assign ongoing responsibility. We'll go through this step one by one through the subsequent slides. So assessing the needs, we need to identify who will use the map and what they need from it. And will it be for students tracking their learning, or for faculty planning the course, or for the curriculum committee, or for all? This is very important because assessing the needs will help us to shape the map in a good way. Second step is scope of task. We need to determine the complexity and depth of the map upfront. Decide how many of the 10 windows we explained early in this video to include and how details each should be. And the tip here is to start with manageable scope. And then, because if you start ambitiously, then this may affect the success of doing the mapping. Then we need to decide on the structure and data. Define the framework for the window. For example, choose the outcome framework for competency-based curriculum. Decide on the content of the taxonomy. Are you using subject, system, or subtopic? List the assessment methods. This step is very important because it involves gathering all curriculum documents, course outline, framework, timetables, and this will provide data that you can use to populate the map. It's very important to assign team to do this task. Choose a technology. Now the technology can help. Previously, the curriculum mapping was in paper or in Excel file. Now, with the software platform, with AI enhanced platform, you can use the right technology to support you. Step number 5, then populate the map. With having the structure here in place, then with all information, all 10 windows, then this means that this will be populated to the course director, to the student, to the staff, and so on, and you have to have your technical team with you. Decide access and permission. Who will have access to each window and to what limit? This is very important. To which limit? This is very important thing that need to be decided through the curriculum committee. Training is very important, because without training, you may face some sort of resistance to implement this. Evaluate and update, because it's evolving issue. It's always you have to keep the curriculum mapping updated, not stick to the first one. And you have to plan for peer review, how frequent to update. You can receive feedback from the stakeholder, from the accreditation body, and so on. And it's very important to assign ongoing responsibility. Identify the coordinators who will do what, and maybe the chair of the committee will be the owner of a curriculum committee, will be the owner of the curriculum map, and who it's very important to identify who should do what at each phase. There are several challenges in mapping the curriculum. The first one is the complexity of the map. You have to start with piloting one phase of the map, or start with one window out of the 10 windows. And if we choose a software, the recommendation here is to choose a friendly use software that can be easily integrated with the existing learning management system in the programs. Some curriculum map, they have data overload, or they are using the data or presenting the data not in a clear format. And the solution here to invest in electronic system, and this technology can support us, or this system can support us to do like analytics with quick updates, flexibilities, and so on. Faculty buy-in. Some faculty may resist this transparency or fear extra work. And this happens usually when we use software that are not friendly use or not fully integrated with the existing learning management system. This is very important thing that need to be considered. Other challenge is ensuring the use of the students. Some students may ignore using these curriculum maps, and the recommendation here is to integrate this curriculum mapping with the coursework, including the reflection, portfolio, and so on. Meeting the stakeholders' needs may be sometimes challenging to meet all stakeholder needs at the same time, because not one size fits all. And the solution here is to provide multiple access viewers. So, for example, those with the administration background, they need to look at the resource. Those for the faculty need to look at what they teach. The students need to look from different windows, and so on. Now we'll move to curriculum mapping for outcome-based and integrated curriculum. Curriculum mapping is very important for outcome-based curriculum and competency-based curriculum, which is currently one of the frequently used approach for the curriculum, because it can be easy visualize the competencies, the domain of the competence, and the EBAs. And it's also very, very, very useful with the modern curriculum that emphasize the different type of the integrations. And because the curriculum map can be explained as the glue which holds the different curriculum part together. It helps to enable continuous improvement of the curriculum. The use of technology is very important. Now we should use technology for the curriculum mapping. Previously it was in Excel file or in a printed file. So the advantage here, it is easy to update, searchable and filterable easy, establish links in clear way. We can promote the students for their learning, personal development plan, and easy doing, tracking, analytics available. Innovation is easy through having these technologies. The take home message here: curriculum mapping is enhanced transparency and alignment between the different parts of the curriculum. It supports the stakeholders' needs. It is integral for the modern health professional education curricula, and implementation is an ongoing process. We can develop it and it can be evolved over the time, and it's ultimately a tool for quality improvement. Thank you so much for watching this video, and looking forward to seeing you in the next series of this video, which will be about discussing a specific part related to curriculum development in health professional education. And the next video will be about constructing problem-based learning cases for health professional education curriculum. See you in the next video.